very good. So I suppose, yeah, we're going into dry off the cows here now. So I suppose what are the key things to be at the front of our mind here as we're going through this very important job, obviously, Dennis?
Yeah, so I suppose the big thing is preparation here now, Pat, to make sure we have everything we need, you know, our cotton buds, our surgical spirits, our gloves, you know, enough gloves that we can double glove. You know, a head torch if needed. I think there's plenty of light inside, but a head torch just to make sure you can see what you're doing. And yeah, and just be well organised, you know. Record keeping is another big thing. You know, we're going doing some selective here this morning, so to make sure that the records have been kept right. So whether it is on an app on your phone or, you know, on paper, whichever, and that the cows are clearly marked afterwards. It is all about hygiene really after that then. So whether you're using an antibiotic or you're not, I suppose using antibiotics have allowed us get away with a lot as regards hygiene. That antibiotic going up first, and then the sealer, like it's a real safeguard up there. But the reality is we're going to have to get used to, you know, drying off cows without them. And either way, you want the hygiene to be really good. So you're trying to get the sterile nozzle of the tube, whether it is antibiotic or sealer, into a sterile teat end, you know, and that's the crux of it. And you know, it's easier said than done. You know, it's easy talk about it. It's another thing to do when your own cows are a bit agitated, when they're dunging, when they're moving. And so look, we will go through a couple of ways of doing it, but it's hard to beat really. I think having an assistant, having help. Another thing I suppose is to milk your cows, go in, have your breakfast, wash up the parlour, and start off on a full tummy.
Yes, and be clear, no rushing the job whatsoever.
Exactly. And have help, and not to be rushy. You know, like that. It's a job really that requires patience and diligence, and I think that the effort you put into it will reward you down the line. You know.
Brilliant. Okay, we'll go at that. So right. So Dennis is just going to do the first cow here. So this cow is going to get antibiotics and sealer. So yeah, Dennis, you can talk us through here as you're drying this cow off.
Yeah, so as we were talking about, Pat, the whole thing here is hygiene, you know, hygiene. And we're trying to get the tip of the sealer, which is sterile at the moment, or of the dry cow tube. It's sterile while the cap is on, so we want to get that tip in contact and up into the end of a sterile teat end. So the whole thing is to keep this sterile, have the teat end sterile, and get up your tube, your antibiotic tube, massage it up into the quarter, and then get up your sealer, and obviously keep the sealer then down inside in the teat canal. So that is the challenge, and it is a challenge because I suppose it's very easy to talk about it, but reality is another thing. You know, cows dung, you know, they move, they kick, you have tails hanging down, so you have lots of things. So it is a real challenge to try and get this done in a sterile fashion. So we'll do our best to demonstrate it anyway.
Very good.
So I suppose there's two ways you can go about it. You can sterilise all the teat ends first, you know. So we're just after spraying them and wiping them now first to have them nice, as clean as possible. But they're not sterile at that. We have our cotton buds and our surgical spirits there. The buds soaked in surgical spirits. So that's what we're going to use. I mean, you can get the wipes as well from, you know, the companies supply the wipes, but I prefer the cotton buds, and I think most people accept now that you do a better job cleaning and sterilising the teat end with the cotton wool and the surgical spirits. So you can either sterilise them all together, and in that case you start in the front, so the front right, front left, back right. So you're working back, and then you tube in the opposite direction. So you don't want to be crossing over your sterile, where you're after sterilising already. So you start, I suppose, back right, back left, front right. The way I prefer to do it is actually do them one at a time, you know. So catch the teat and don't leave that teat go until you're finished. So sterilise it, put up the antibiotic tube if you're putting it up, put up the sealer, and then move on to the next one, you know. And it's probably, you know, I think if you have help, and really it is a two-person job, you know, I think you can move just as fast if two people work together, sterilise, tube, go on to the next teat, sterilise, tube, and move off down the line. Two people working separately, you're always reaching, much harder to stay clein. So one person can try and stay as clean as possible, and the other person can assist. You know?
Okay, very good.
So here we go, Pat. So I'll let you. So we're going to start front right. We'll finish with that one. Front left. Finish with that one. Then we'll move back to the back. You know. So and you can hand me the tubes. So really, what you're trying to do, the teat end is at the bottom, and that's the part we want to sterilise, is the teat end. And really, clean is one thing, but sterile is another thing, you know. So and it's not sterile really until you look at that cotton bud. See, there's dirt on that.
Yep.
So we're not happy. That's not good enough. The great thing about the cotton buds is you can just turn them around and go again. We're pretty happy there now. It is nice and clean,
yeah.
and there's surgical spirits dripping off it. So we'll get our antibiotic tube there now. So then the whole thing is to keep the top of this sterile.
Yep.
We're after sterilising our teat end. And then we want to catch it, massage it up. We're going to sterilise again, then we're going to get another cotton bud. We're happy that we're sterile again. And now our sealer. So we're not massaging up the sealer now, we want to keep it in. And you'll feel that.
So you're catching the T canal there and closing it as such with your left hand, Dennis.
I am. I'm blocking it. You don't want the sealer, you want to keep the sealer down inside in the teat canal.
Yeah.
And then you take it out. What I like to do then is just give it a slight squeeze just to make sure a little bit comes out the bottom and that the teat end is actually sealed as well, you know.
Yes.
So that's that one done.
Very good.
So this is our bin here, sure, isn't it?
Yeah.
We'll start using our bin.
So you're going with your spirits again then, is it?
We'll keep going, yeah. So we're moving on to the front left now. So again, we're sterilising the teat end. We're scrubbing away till we see no dirt whatsoever there. Our swab there now is not.
Clean
We want to do better.
No.
So this is our antibiotic tube. We want to massage that up in. We got it. We'll give it one sterilise again just to make absolutely sure before our sealer goes up. And we're clamping the top of the teeth to make sure it doesn't go up into the other. And there's a bit of pressure required. And again, we'll make sure a little bit comes out the bottom. We're happy with that.
Very good. I'm wiping again.
This lady likes to stand with her legs very close together. She's after hearing me. So we're good. So it takes a nice bit of scrubbing actually to get them really clean.
Yeah, there was.
You know.
Yeah.
And the beauty of it is you can turn it around and go again. I'm actually not completely happy there now. I'm going to go again with that one. You see cows move, Pat, you know, it's not it's not a simple.
You really see it is useful to just leave one person at one job and focus on that, really, isn't it?
It is.
Not moving from teat to teat.
Massaging up in. Get it. And then we're grabbing the teat in, we're going to sterilise again. And if everything is there alongside you, you can actually move away quite quickly.
Yeah.
And we'll just let a small bit come out then, and we're happy that it's coming out the teat end.
Should be fully closed.
That's it. And then we're moving on to the back lift. This is quite a clean. The teat ends are in good condition here, Pat, actually.
Very good.
This is the one time a year you really get a chance to look at the teat ends. It's probably a bit late to be realising if they're in poor condition, but
Again, you're wiping between the antibiotic and the sealer again, Dennis.
I am. It's not a big effort, I think, to do it, to be honest, you know, and things can happen, like something can move, you're catching the teeth, the end of the teeth to massage up the antibiotic.
Yes.
And really, and there's a bit of pressure required when the sealer is going in, you know. to actually, it's like a balloon.
Yeah.
The teeth canal is going to fill up with the sealer. So, and really it is critical to hold the top and make sure it stays there.
It stays in the teeth canal rather than going up into the other,
yeah.
So we're going sealer only, so on disco here, Dennis.
Sealer only.
No antibiotics, so similar procedure again. You have to clean in between cows here again.
So yeah, I just got a small bit dirty there, so it took the time to clean again. So again, I suppose it's the right hand. Your right hand is kind of the cleaner hand. You know, obviously both hands have to be clean, but this is the hand that's going in actually catching the teeth, and this is the hand that's going to be sterilising and tubing. So again, we're sterilising the teeth end, and clean is not good enough, Pat. We want it actually sterile. So always take a look. You know, there's a slight bit of dirt there, so we'll
use another but yeah.
We'll go again. Teeth end is in nice condition there. A few little warts there, but they're nowhere near the teeth end.
Okay.
So we're sealer only. So we're clamping up the base of the teeth, good and firm. We've just taken the nozzle off, so the nozzle is sterile as well now. So a sterile nozzle gone up into a sterile teeth end. The whole lot is after going up there. Small bit came out, wouldn't worry about that. That's just the pressure coming back again.
Yes. And you had again there, you had the canal closed again, we'll say, going up into the other. Yeah,
like a voice scripts at the top really to you want to keep that sealant
just
inside in the teeth canal.
Yeah.
So happy with that. It's nice and it's clean. It's sterile. And again, I have the base of the teeth well clamped. The small bit comes out. That's okay.
Yep.
That's just the pressure coming back in. It means that the canal is completely full of teeth sealant.
Yeah.
So we front right, front left. We're going to get slightly difficult now here. Small bit of dirt there, Pat. I'm going to just
another one.
Swab again.
Yep.
So we're happy now that our little bud is perfectly clean. Nozzle is sterile as well. The base of the teeth well clamped. And it really swells up like a balloon. And the small little bit comes out the end, and that's okay.
Very good. Last one then.
Teeth ends are in good condition here, Pat, so it is
job easier.
Makes it easier, and really a cow that has teeth end damage, you can always change back. She might have been selected for sealer only, but if her teeth ends aren't in great shape, you're as well off maybe to change tact.
Go with antibiotic.
I'm going to go again there actually one more. Swab one more time. Till we're happy that it's completely sterile and clean. And then to get the nozzle up, just slightly difficult to get up into her now.
Yeah.
So well clamped. All of it comes back out, and that's the job.
Perfect stuff. Brilliant.
So that's it. That's our four cows done. So 2 with antibiotic and sealer, 2 that have been selected for sealer only, and our next job now is to record them, Pat, and mark them. So so they can be identified. We'll mark them separately, which is no harm because we know these ladies are after getting an antibiotic. They're at slightly less risk, even though we did our absolute best with the procedure. These ladies have got no antibiotics, so we might put a different colour on them so that we can keep an eye on them. We want to keep an eye on them all, obviously, but just keep a special eye on these to make sure they're okay for the next couple of weeks.
Perfect. And no, that's brilliant. Thanks for that, Dennis. And I suppose, would you recommend now leaving these cows out to the cubicle house, ideally out to field, or what would be your recommendation there?
Yeah, so I suppose that's part of our planning that we spoke about earlier. So Sure, look, if the weather is permitting and you have a paddock, it's great to leave them out.
Yeah.
So the big risk period now is the next 10 to 14 days while they're soaking up after being dried off.
Yes.
So it's hard to beat the paddock, you know, that they're going to be able to stretch out outside in the paddock and it's a clean environment.
Yeah.
If they're staying inside and the weather is bad, really you want to measure or manage those cubicles as if they're milking, you know, so
Okay.
the same level of hygiene. So liming, cleaning and liming twice a day, maybe disinfecting the line, running the scrapers, all those things to keep them as absolutely clean as possible. Yeah, and monitor them closely then as well for any leakage or any signs of mastitis, and you know, and take action if you see anything.
Again, then.
Yeah.
Okay, great stuff.